Exposed to the elements, hungry and struck by disease. Africans who have crossed the sea from Djibouti in search of a better life are the latest victims of Yemen's cholera epidemic. This dusty hospital courtyard in the southern province of YAHYA has become a makeshift ward. Security forces brought the sick from a migrant detention center, but the hospital was full. Many have already died of the disease. There's barely enough food and water, and hospital staff work with limited supplies to keep survivors alive.
Today we were fed during lunch, one piece of bread and one flatbread. Nothing much, and the people here are still hungry. It is not enough. There is so much heat, and there's no air conditioning in the detention center. Even the water is little and not good enough for drinking.
It's estimated that more than 4,000 African migrants are in Yemen. Security forces in the cities of Aden and YAHYA have detained them in camps where poor conditions have allowed the epidemic to thrive.
They are dying before our eyes and we cannot do anything. There are still cases to come. Just a few minutes ago, the authorities called and told us that there were still more than 100 cases in which the patients were critically ill.
The destruction wreaked by Yemen's 4-year civil war has created prime conditions for the spread of cholera. Fighting and airstrikes have damaged sewage systems and water stations, and many people don't have access to clean water. Cholera is spread by contaminated water, causing dehydration through vomiting and severe diarrhea. In the capital Sana'a, health workers go door to door giving children the cholera vaccine. It's a slow process, but these drops could mean the difference between life and death. In March, the UN reported that the number of suspected cases had increased by 150% in the space of a month. And a quarter of those affected this year are young children.
We go to houses and give the vaccines and educate people because it's a very dangerous disease.
Vaccines cannot ensure immunity, and their effectiveness declines rapidly after a year. But this temporary measure is the only option to help stem the spread of cholera, an epidemic adding to what's already regarded as the world's worst humanitarian crisis. Ijeoma, Ndukwe, Al Jazeera.